Hi everyone, my name is Christy and today I'll be teaching you about increased awareness of hunger and satiety. We'll be going over the introduction, dieting versus attuned eating, activity, process, and how to use those graciously, tips, validation, and references. Attuned eating is also known as intuitive or mindful eating. My target population is binge eating disorder. The purpose is to identify internal cues of hunger and satiety. So dieting versus attuned eating. Dieting and fads often lead to binge eating and stray away from attuned eating. This is more chaotic because it is less reliable and inconsistent. And then also we see with dieting there are many restrictions, so they lose touch with their internal cues of hunger and satiety. And eventually end up weight cycling or becoming overweight, which leads to the dieting paradox. So here are just some terms to identify with diet and attuned eating. Diet is guilt, fear, shame, judgment, whereas with attuned eating we can see satisfied, pleasure, trust, compassion. So there are more positive terms associated with attuned eating. Okay, so this is the activity pretest for attuned eating. This was designed at the Renfrew Center, which is a major eating disorders treatment center. I will provide the link below so you can access it. You simply just answer the questions 1 through 12, yes or no. So you could see, for example, can you eat when you are hungry and quit when you are satisfied, yes or no? Number 2, do you stop eating because you think you should, as opposed to because your body is satisfied, yes or no? So you would simply just go through all 12 questions. So after the pretest, you would just score up your responses, 1 point for each no response on the odd number questions, 1 point for each yes responses on the even number questions. Total those up, and a score between 0 and 3 indicates a healthy attitude towards eating. Between 4 and 8 suggests cultural pressures about appearance and ideas about how much and what kinds of foods to eat may be negatively affecting self-acceptance. Scores between 9 and 12 suggest serious issues with food, ranging from food obsession to an eating disorder. Okay, so the next step is to identify hunger. You want to just ask the patient when they know if they're hungry. Do you feel signs of growling stomach, weakness, headache, irritability, fatigue? You don't want to be in that state where you're feeling uncomfortable. So the starving state is the worst possible state you can be in, because at that point you don't know what your body craves. You're just going to eat about anything that's there and available, which essentially leads to binge eating. So we're going to use the hunger scale to help identify those needs. They range from 1 to 8, and taking a closer look, you could see that there are different levels. So you want to somewhat be in the range of somewhat hungry, hungry, or moving into very hungry. Because at that point you can know what your body wants and you don't have to go through that discomfort. This will actually range from person to person. They say to wait for cues, so you don't necessarily have to go through breakfast time, lunchtime, dinner time. Just wait for those internal cues to know when you're actually hungry. There are some limitations though with this, because binge eating can happen when you actually skip breakfast in the morning. So it's just like an experiment of getting to know what your body wants and getting to know that hunger scale a little bit better. Okay, so the last step is identifying satiety, and it's always easier to identify hunger than it is to identify satiety. So when you're actually hungry, it's good to actually eat then so you know what your body craves, and then also recommend that if they have a larger portion, they don't have to eat it in one sitting. They can go back and finish it later, which gives them a new opportunity to practice their attuned eating. I also recommend that it's better to stop eating sooner than later so you can feel that feeling of satiety. And also, lastly, it's all about moderation, no restrictions, no dieting. Attuned eating is key. So in order to use this technique effectively, it's important to be welcoming, understanding, and open-minded. Remember that a person is not bad for eating past their fullness. So do not pass judgment, but rather look for meaning in their behaviors. And then remember to aim. A for attunement. So remember physical hunger cues and choose foods that satisfy. And I is for intention. So visualize yourself and how full you want to be at the end of the meal and that level of comfort you want to achieve. Mindfulness is bringing awareness to the eating experience, and do not have any judgment or expectation. Let the patient enjoy their food without any judgment. So research showed that binge eaters who are attuned eaters help to normalize their relationship with food because they listen to physical hunger cues and ate exactly what they're hungry for and stopped when they were full. Overall, they were able to trust their body signals. And another research study of 33 individuals in a 10-week intervention showed promising benefits to attuned eating. And then lastly, we have another research study that showed mindful eating approach was effective. It helped to decrease food cravings and decrease BMI and reduce binge eating episodes. Overall, it improved the regulation and self-efficacy of eating behaviors. Okay, so here are my references, and then I'm all done. Thank you for watching.